my name's Natalia. I'm going to be doing a cranial nerve exam on you today. So it's going to be just a series of tests that involves like checking your vision, your hearing, things like that. Does that sound okay with you?
Yes.
Yep. Okay, awesome. So for the first cranial nerve, olfactory. So this is not typically part of a therapist's exam. So, but how I normally would test it is taking a couple of non-irritating odors, or not odors, scents, and putting them up to the patient's nostrils individually. So I'd have them like plug first the left and then the right, testing each nostril's ability to detect the scent. And an abnormal finding would be an absence of smell, senseless smell. But we're not going to be doing that. So then, now moving on to cranial nerve 2, which is the optic nerve. For this one, I'm going to be testing the confrontation visual exam. So this is me testing all 4 quadrants of the patient's visual field. So just explaining this to them. So all I'm going to be doing is like bringing these little cotton swabs first in like this and from the bottom, and just asking the patient to verbalize whenever they see them in their visual field. And yeah, okay. So what I'm gonna be doing now is taking these cotton swabs, and I'm just gonna place them a little bit behind your head, and all I'm gonna do is kind of bring them in slowly, and you just let me know whenever you see them. So you'll say the word yes whenever you see them come into your field of view, okay? And for this, I want you to go ahead and keep your head straight. Don't be moving around, and yeah, just keep your vision straight. Okay, starting here. Whenever you see it, go ahead and say yes.
Yes. Yes. Yes. Yes.
And now moving on to cranial nerve 3, which is the oculomotor. For this one, I'm going to be doing accommodation testing, which for this, I'm going to be looking for 2 elements being convergence of the eyes, so them both coming in equally to focus on the object, and pupillary constriction. So yeah, I'm just going to be using the same cotton swab, kind of bringing it in slowly towards the patient and trying to look for both of these elements, or both components. Okay, so now what I'm going to do, is take this cotton swab, and I'm just going to be bringing it slowly towards your eyes, and without moving your head, being still, just keep your eyes focused on the tip, okay? Here. Okay. And do it one more time. Okay, nice. Okay. And now, moving on to cranial nerve 4, which is the trochlear nerve. So for this one, I'm going to be doing the H test, which is me just drawing the figure H and observing the eye movements. So this is actually also going to be the test for cranial nerve 6, which is the abducens. But for the trochlear, I'm going to be looking that both eyes can be depressed when they're adducted, so brought towards the middle. And then for the abducens, I'll be looking for that both eyes can abduct, or go to the side. So, okay, so for this one, I'm just gonna ask you to, kind of similar to the last test, just keep your eyes focused on the tip of this cotton swab. And I'm just gonna be kind of making a few figures, and for this one, make sure to not move your head, and just be moving your eyes, okay? So we're gonna keep your eyes focused. Okay. So now testing cranial nerve 5, which is the trigeminal. For this one, I'm going to be testing both components, both sensory and motor. So for the sensory portion, I'll be taking like a cotton swab and kind of bringing out the wisp a little bit so I can test light touch on the 3 parts of the face that are supplied by the 3 branches of the trigeminal nerve. And I'll just be asking the patient to say yes whenever they can feel them. And then for the motor, I'll be asking them to clench down their jaw and palpating for their muscles of mastication. So, okay, so what I'll be doing now is taking this cotton swab and just kind of tapping them along like a few points on your face. And every time you feel them, I want you to say the word yes. Okay, so just for practice, we could try like on your hand. So I would tap it like this, and every time you feel it, you say yes. So
Yes.
you say yes. Okay. And now now we'll try it with your eyes closed. So you're gonna close your eyes for me. Okay, whenever you feel it, go ahead and say yes.
Yes. Yes. Yes. Yes. Yes. Yes.
Awesome. So that's for sensory. Okay, and now the next part of this is I just want you to kind of bite down and clench your jaw. And I'll be just feeling around for a couple muscles to see if they're activating.
Okay.
Okay, so go ahead and bite down for me. Okay, and relax. And bite down again. And oh, it's okay. And bite down again. Relax. Okay. And okay, cool. So I was able to feel those. Okay, so now for cranial nerve 7. This is the facial nerve. So for this, I'll be asking the patient just to perform a few facial expressions. And what I'm looking for here is that there's symmetry between both sides and making sure there's no facial drooping or anything like that. Okay, so what we're gonna do now is I'm just gonna ask you to make a few facial expressions. And we're just gonna be looking to see if there's symmetry and things like that. Okay, so first one, I'll have you just raise your eyebrows for me. Okay, and then if you could frown, make it like a side face like that. Go ahead and show your teeth. Okay, and smile. Okay, and close your eyes as tight as you can. Okay, nice. And then if you could just like blow out your cheeks, your cheeks. Okay, nice. Okay. Now for cranial nerve 8, vestibular cochlear. It has two elements, so the vestibular and the auditory or the sensory. But for this one, we're just gonna be testing the auditory or the sensory. So for this one, I'm gonna be just rubbing my fingers up against their ear and asking them to tell me yes whenever they hear. So, okay, so what I'll do now, all I'm gonna do is kind of place my fingers against your ears and kind of be rubbing them. And if you can hear them and when you hear them, just say the word yes.
Okay.
So get started, so close your eyes for me.
Yes.
Okay.
Yes.
Okay, now for cranial nerve 9, the glossopharyngeal. This one is in charge of palate elevation. So for this test, I'm just gonna be asking the patient to say ah for me, and I'll be looking to make sure that the palate is symmetric in its elevation. So, okay, so go ahead and say ah.
Ah.
Okay, and one more time.
Ah.
Cool. And now for the vagus nerve, cranial nerve 10. So for this one, I'm going to be testing the muscles of articulation and speech. So with the Pataka test. And for this, I'm gonna be wanting to see that the voice is clear and there's no hoarseness, no slurring, or that the voice is quiet or anything like that. So yeah, I'll just ask the patient to say Pataka. Okay. So now what I'll have you do is, if you could just repeat the syllables Pataka for me, and just a few times just to see how you're able to pronounce them, okay?
Okay.
So go ahead and say Pataka.
Pataka. Pataka. Pataka.
Okay. And now spinal accessory. So this innervates both the traps and the SCM. So I'll be doing an MMT just to see the strength of these muscles. Okay, so for this one, I'm just gonna ask you if you could elevate your shoulders for me. And I'm gonna be applying a little bit of pressure, and I just want you to hold them there and don't let me move.
Okay.
So go ahead and raise your shoulders. Okay. And hold. Okay. Nice. And then for the next one, if you could just turn your head to the left. Okay. And turn your head to the right. Okay. Nice. Okay. And now the last nerve, the hypoglossal. All we'll be doing is evaluating the patient's resting tongue position. So I'll ask them to stick it out and also be moving it around to see if there's any, sorry, my bad, what's it called? Irregularities, like side to side. So, okay, now all I want you to do is stick your tongue out for me. Okay, and nice, you can put it back in. And now you can stick it out again, but just be like moving it side to side for me. Okay, nice. Awesome. Okay, and those are all of the cranial nerves.